Hi, my name's Casey. I'm going to be your nurse today. I'm going to wash my hands. Can I get your name and date of birth for verification?
Kyle Ernie, April 7th, 1996.
And do you have any allergies I should be aware of?
Bees.
Okay. So today we're just going to go through some cranial nerve testing just to make sure all of your nerves are intact. So the first one that we would normally do is a smell test, and we're not going to do that one today. And the second one is for your optic nerve, and normally that's when you do an eye chart. So I would have you close one eye and stand 20 feet away and read the lowest line possible, and then switch eyes, read the lowest line possible, and then do both eyes, but we're not going to do that one today. Normally, if we were going to do that, I would record the lowest line possible without you missing three, and then I would record the eyesight in a fraction manner. Today we're just going to start with cranial nerve 3, and that is the oculomotor nerve. And so I'm just going to have you face me, and I'm going to have you keep your head still and just follow my pen. Good. And now for the next one, I'm just going to have you look behind over my shoulder and keep your eyes still, and I'm just going to look at how your pupils react to the light. Good. Pupils are reactive, and they're about 2 to 3 millimeters in diameter. Good.
Excellent.
And pupils look round. They are, not oval or out of shape. And for the next one, I'm just going to have you, again, just look this way and follow my pen light. Good. And that was testing cranial nerve 4. So the next one we're going to do is the trigeminal nerve, and I'm going to push some resistance against your jaw, and you're just going to try and open your mouth against my resistance. Okay, good. Resistance intact. The next one, I'm going to go back to the pen light. I'm going to ask you to try not to move your head at all and just follow my light. Good. And I would document that. And then number 7 is the facial nerve. And I'm just going to ask you to do a chewing motion. I'm going to ask you to say a 2-syllabus word. I'm going to have you say football.
Football.
And then I'm also going to have you close your mouth and smile. Frown. Raise your eyebrows. And puff your cheeks. Good. Okay, cranial nerve 7 is intact. Next is the hearing aspect of it. So I'm gonna plug one of your ears, and I'm gonna whisper a word, and you're gonna have to tell me, repeat back the word that I say to you. Baseball.
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 Let's do this one again since I just didn't whisper.
Football.
Yes, good. The next nerve we're going to do is number 9. And I'm going to have you say ah as I look in the back of your throat.
Ah.
Good. Okay. I would document that the uvula rises to the midline and that cranial nerve is intact. The next one is the vagus nerve. And I'm going to have you state your name.
Kyle Ernie.
And your date of birth.
April 7th, 1996.
And I'm just going to have you swallow, and I'm going to feel for it. Okay, good. Thank you. And now document that that nerve is intact. And then for number 11, I'm going to push against your shoulders, have some resistance against it, and you try and fight that resistance. Good. And I'm going to have you push against my hand this way, and push against my hand this way, and the back of your head as well. Good. Okay, full resistance for that one. And then for the last one, cranial nerve 12, I'm going to have you stick out your tongue and move it side to side. Good. Okay. I would document that cranial nerves 2 through 12 are intact, and I would wash my hands, make sure my patient has everything they need, put their bed in the lowest position, put up their side rails if they were at the hospital, and I would make sure they have their call light.
Very